Hi, my dear students. Let us discuss MCQ of child health nursing. So here you see the first question. The following are the characteristics of first stool of newborn except. So here they asked a question. What are the characteristics of first stool or meconium except? The answer is it lacks bile pigment. So this is not a correct statement. It is odorless. It is tenacious. It contains epithelium cells, lanugo and hair. But lack of bile pigment is not a correct statement because meconium also contain bile pigment. Then, see the next question. In case of newborn whose mother has had untreated syphilis since the second trimester, which of the following an appropriate time of action? Here, the newborn mother has untreated syphilis from the second trimester. So, what appropriate action we have to take now here? The answer is testing for congenital syphilis after birth. Okay, here you can see. So, these untreated syphilis, if the mother has untreated syphilis since the second trimester, it causes congenital infection to this infant. And do you know that it is asymptomatic? It is asymptomatic during infancy. We can't recognize whether the child has infection or not. But when child reaches childhood stage, it shows physical symptoms like deafness and cataract. So that's why the baby is asymptomatic at the situation. If the baby is asymptomatic at the situation, compulsory, the newborn must test for congenital syphilis infection at birth as soon as possible. Take the test from the infant for detecting this congenital syphilis infection at birth as soon as possible. Already I said the reason is it is asymptomatic. We can't recognize whether the infant has this infection or not. Okay, then next third question. In a newborn, the anatomical closure of ductus arteriosus occurred. In a newborn, anatomical closure of ductus arteriosus occurred. The answer is 10th day of birth. Remember, so ductus arteriosus is a blood vessel, and the function of this ductus arteriosus is it connects the pulmonary artery and aortic valve. Nothing but it bypasses the fetal line. And here they asked a question, anatomical closure occurs at 10th day of birth, but functional closure occur soon after birth within 18 to 24 hours of birth. Anatomical closure on 10th day, functional closure after birth within 18 to 24 hours of birth. Okay, the next question. Closure of newborn foramen ovale is caused by. Closure of newborn foramen ovale is caused by. The answer is C. An increase in pulmonary blood flow cause or helps in closure of newborn foramen ovale. Then here you see foramen ovale closes shortly after birth, a result of hemodynamic changes related to respiration. The next question. Before birth, which of the following structure connects the right and left auricle of the heart? The answer is foramen oval. Foramen oval. Right? Okay. So foramen oval connects the right and left auricles of the heart. And it is not a permanent opening. Remember, this foramen oval is not a permanent opening. It is a temporary opening between two atria of the fetal heart. Okay, just it bypasses the immature lung. Okay, the next one, failure of foramen oval to close will lead to. Failure of foramen oval to close will lead to. The answer is C. Arterial septal defect. Arterial septal defect. The next one. Next question. Then next question. Caput succedaneum is birthmark, swelling on the face of the baby, collection of fluid under scalp, swelling will not cross the suture line? The answer is collection of fluid on the scalp called caput succedaneum. Okay. Then, so these are the cause of this caput succedaneum. Mainly it occurs in cephalic presentation when head compresses against the cervix during delivery. Okay, then the swelling reabsorbs within 2 to 3 days or within 36 hours it disappears. The next one, caput succedaneum resolve within. We have discussed 2 to 3 days or 2 to 4 days. Okay, resolve within 4 days. Then, when providing a nursing care to the newborn, the mother is raising a question. When you are providing nursing care to the newborn, the mother raising a question. When will this succedaneum disappear? So, what response would you give to this mother? Within few hours, within 12 hours, within 24 hours, within 36 hours. And here you see that the answer is within 36 hours. The next one. Edematous edematous area in the scalp of the newborn as a result of prolonged labor called intracranial bleeding, subdural hematoma, cephalohematoma, caput succedaneum. The answer is caput succedaneum is nothing but edematous area in the scalp of the newborn as a result of prolonged labor. Okay. So this is about MCQ of child health nursing. In the next class, we can see remaining MCQ of it. Thank you all. And don't forget to subscribe my channel. Thank you.